Believe it or not, it was 5 years ago today that COVID was declared a global pandemic. The acute stage, of course, is long past, but all these years later, there are those who bear the scars. CTV's Kathy Lee spoke to one woman still living with long COVID. And Kathy, what did she tell you?
Sandy, the symptoms for long COVID vary widely, as does the severity of those symptoms. But some common ones include brain fog, extreme fatigue, and shortness of breath. All of those symptoms and many others have robbed Diane Sandbrand of a normal life. She had COVID in April 2022, was bedridden for a week, and has not been able to recover.
It's like a feeling of dying, basically, or being poisoned.
She used to have a fulfilling career and traveled the world, but since she got sick, she can't do any of those things anymore. Sandbrand needs mobility devices to walk, and it only takes a few steps before she is winded and needs to rest.
There's sometimes where I just lay in bed with my sleep mask on, and I try to block out all the sound, and that's all I can do on my very worst days.
There is ongoing research and clinical trials underway around the world to better understand long COVID. However, one doctor says with closures of some government-funded long COVID programs, like in Alberta, coordinated support is lacking. His wait list is now 2 years long.
Patient groups and other advocates have tried to create sources of reliable information to try and put it out there where people can try and find things. But in terms of a health system approach, I don't know that any province is doing a great job.
Statistics Canada estimates 1 in 9 adults, or 3.5 million, have experienced long-term symptoms from COVID-19. Sandy.
All right, CTV's Kathy Lee.